remain without health insurance because of the lack of action on the part of our state legislature. We're here today too because of the 15,000 plus jobs that are not being created because of the lack of action of our state legislature. And we're here because our rural hospitals continue to be at risk because of the lack of action by our state legislature. Just recently, there have been several studies to come out to highlight the difficulty of people paying their medical bills. Since 2012, the number of people having difficulty paying medical bills has decreased across the country by 9 million people. The fact of the matter is that in Tennessee, that decrease is much less because we have not passed Insure Tennessee. Also, a couple other notes that are important is that Tennessee is leading the nation in personal bankruptcy. You know, we were always hanging around as number 2 or number 3, but now we can sort of say, gosh, we're leading the nation in one more thing, personal bankruptcy. So, and personal bankruptcy is caused primarily by medical bills. So when medical bills go unpaid, that is a result. But we're here today to hear from several people, leaders in our community, to share with you the importance of the passage of Insure Tennessee. So first I'm going to introduce Professor Getz. He's a professor at Vanderbilt University in economics, and he's been doing this since the early 1970s, and we appreciate you being here today.
Thanks so much. It's a pleasure to be here. Without medical insurance, an illness or accident compounds into a major economic crisis. Loss of work, loss of job, loss of income, loss of health insurance frequently causes spending down savings, accumulating debt, and in the extreme, personal bankruptcy. With insurance, access to good quality primary care reduces the likelihood and severity of important illnesses. Health problems like diabetes, hypertension, and asthma can be managed in a way that allows people to continue to work and be productive citizens. In today's gig economy, more people are working full-time jobs without health insurance. People in Tennessee often are not eligible for Medicaid, but don't earn enough to participate in the health insurance exchange. And that's the role of Insure Tennessee, to fill the gap between Medicaid and the insurance exchange. Insure Tennessee is an important advance for our state.
Thank you so much. Good afternoon. My name is Shannon Blaylock. I am a retired nurse. I have years of experience in hospital managed care, and I want to take a few minutes to encourage everyone to support Insure Tennessee. I hope to give you a few good reasons to contact your legislators and ask them to support Governor Haslam's Insure Tennessee plan. But first, I'd like to tell you my personal story of a time when I needed help from a program similar to Insure Tennessee. Through a series of circumstances, I found myself divorced and with a child at 18. I was just out of high school, and I had nothing, not even a car. I realized in short order that I was going to have to get an education in order to provide for my child. So I enrolled in a university by taking out student loans and grants, and I also qualified for a program that's similar to Tennessee's TennCare, since I had a dependent child. But during my senior year at the university in nursing school, I had to have an unexpected major lung surgery. I spent 5 days in ICU and another week on our general floor. My medical bills were astronomical. If it had not been for the insurance I had, I would have been ruined. I would have been bankrupted before I ever got out of college. All my hard work up to that point would have been for nothing. But I did graduate, and I went on to have a successful nursing career. And I tried during those years to give back to my community. But most importantly, I never forgot what it felt like to have a need. I never forgot what it felt like to get a helping hand. And I never forgot what it felt like to get it. There are 280,000 hard-working people in Tennessee that need that helping hand right now. These people are poor, yet they're not eligible for TennCare or for financial assistance to help pay for insurance on the marketplace. This helping hand would be paid for by the federal government and Tennessee hospitals. All our legislators have to do is say yes to Governor Haslam's Insure Tennessee plan. If we don't say yes, then billions of dollars will be kept in Washington, D.C. Tennessee has already lost $2 billion and over 15,000 jobs in the last year. $2 billion, that's with a B. That is a lot of money. Insure Tennessee will not only save lives and reduce suffering, but it'll pump billions of dollars into our economy, save our hospitals, and help us have a healthier state. But I've heard a lot of people ask, how are we going to pay for this? The federal government, and I want you to listen to this closely, the federal government will pay for this at 100% through 2016. From 2017 to 2020, the federal funding will gradually be reduced and go to 90%, but it will stay there. It will not go below 90%. Tennessee hospitals believe so strongly in Governor Haslam's plan that they have said that they will fund all costs that the federal government does not cover so that the program will be fully funded and ongoing. What hospitals can't do is continue to pay for unreimbursed care. Without Insure Tennessee, hospitals across the state will be at risk of closing or cutting services, which could result in as many as 20,000 job losses. We are all here today to ask our legislators to support Governor Haslam's Insure Tennessee plan to provide 280,000 Tennesseans with health care coverage, bring $1.4 billion per year to the state, and keep our at-risk hospitals open. Thank you so much.
A native Tennessean, and as one person of a particular faith, with a call to many people of all faiths. Last week I stood amongst fellow Christians at an interfaith dialogue with Nashvillians who happened to be Jewish, Islamic, Buddhist, and Hindu. As each group took turns speaking about the essence of their faith, at the core of their values, there was a clearly woven thread from the tapestry of all the world's religions, a thread of compassion for all people. We gather here today to summon that sacred and courageous voice of compassion, which has been spoken in new ways through all the generations. The call for compassion today is before us, embodied in the 280,000 Tennesseans who have fallen through the cracks of our healthcare system. The cause of our great crisis is not one to be taken up by just a particular group. For sickness and disease do not know religion, nor do they discriminate against any race, gender, sexual orientation, or age. They are our friends and our neighbors, our hourly workers, and single parents all the same. All of whom are united by the mounting pressures of providing quality, affordable health care for their family. And now, over half of all bankruptcies in our nation occur because of medical debt. But a great man once declared that if a free society cannot help the many who are poor, it cannot save the few who are rich. The voice of compassion calls us today to help the many who are poor, the 280,000 Tennesseans who would be covered by Insure Tennessee. The voice of compassion is one which envisions a better world in which we come together to demand of our public servants that they serve the public first. Not special interests, not what is expedient, but what is right. To those in the legislature who would deny access to health care for the most vulnerable in our society, I would say only this: if you have a better idea, you have a moral obligation to put it out there. But if you do not, if your plan to take care of the sick and the vulnerable in our society is merely to turn them loose, to beg on their own to churches and hospitals to provide care which they cannot afford, that plan is pragmatically unacceptable. But if somehow your plan is to turn them loose with nowhere to go and no one to speak for them, to be turned away in their hour of maximum need, that far worse is morally unacceptable. We shall never back down from the knowledge that in the wealthiest country in the history of the world, no person should ever be turned away from her doctor because she is sick, or have to declare bankruptcy in order to afford a life-saving procedure. Healthcare is not a political issue. It is a moral issue for all people. It is time to declare healthcare a fundamental human right. How can any of us go before God knowing that we said nothing, that we did nothing, when our brothers and sisters across this great state faced an existential crisis? Some with their life literally at stake, many more with their liberty in jeopardy, and with 280,000 people in our state whose pursuit of happiness is dependent on our ability to come together and do the right thing. As the ancient scripture commands, we must undo the heavy burden and let the oppressed go free. In the land of the free and the home of the brave,